This is an example of the pyramid methodology, and now I'm going to switch into talking about how we use it. It is a management tool being utilized by agencies around the country. We've got several universities teaching this, and one of my primary goals here at NC State is to get it integrated into curriculum so that you all are learning either at a decision-making level or as a student or as a practitioner, whatever level you're coming at, as a taxpayer, why this is important and how this tool can help in our communities, because we all live in a community. We want to be able to articulate the level. We want to raise the issue of what our core services should be. And then we have another tool that we'll talk about in a different module that talks about the services assessment that gets into those core services. But we're really talking about where should our resources go and where should we be getting cost recovery. Here's the model, and if you take a little closer look, it is, if you see at the bottom, it's basically the base is the community benefit. We've just talked about that. The justification is that because we have money coming from the community, the primary benefit from our community, from everything that we offer, should be a community benefit. As you look at the left-hand side of the pyramid, you see the bottom level could be either no cost recovery and subsequently full subsidy. And as you move up the left-hand side into the higher levels, you see that we get to a revenue positive or an enterprise. Now these are a gradation, and as I said, it's going to be different in every single community. Some communities may have nothing that is revenue positive, and that's okay for them. So in some communities, they may have everything has to have some sort of revenue around it because they have to have that to survive as a governmental business. And so it's really important to keep in mind that these things are, what we're trying to determine is what that scale should be based on that community. So as you go up, we start with mostly community at the bottom. Each level, second level, is considerable community benefit. There's a little bit of individual. The middle is about mixed. Level 3, we consider it's kind of benefiting both equally. As you go to level 4, it's primarily individual, although there's still community benefit. And that level 5 is mostly individual benefit. There's very little community benefit. And we often call that an ancillary service. It's something that's not there primarily for the community as a whole, but it's something that we can provide. Quite often it'll have a revenue positive effect. And it's things people still want. It's related somewhat to our mission, as we'll talk about that. But it helps us get to this idea of, is it primarily a community benefit or primarily an individual benefit? So that's the basis primary filter for the pyramid methodology. So this is just the whole idea of the community benefit. To define that even further, we're talking about, does it have a positive economic impact? A lot of times things like having a park will help the price of home value, so that's a community benefit. Does it increase public safety? Sometimes things like having midnight basketball leagues will help keep youth off the street, and it helps that kind of safety. Addressing social needs, are we helping take care of those folks who really need that kind of service or program? Or does it just enhance basic quality of life? Are we getting a better life out of it, and therefore we enjoy living in that community more? Here's an example, and it's using aquatics as one form of, one division in an agency. Way to think about this, at the bottom level, typically having a body of water. People like water, and we know from research that about 50% of the population in the United States love water. They want to be wet. That for them, it's a way that they recreate their body, mind, and spirit. So having access to water or even being near water is a community benefit for them. About 50% of the population could care less if they ever get wet again. So we have both of those types, but 50% is a pretty high number of people in a community. So having a body of water is typically considered a community benefit at level 1. Sometimes we'll talk about things like spray grounds where they're not monitored. We don't have staff there, so that could be at the bottom. If you move up to level 2, having things like a water park or a pool, having a place, usually there's somebody there staffing it, and there's usually an admission price, but most pools do not make money. They're very difficult. If they were making money, they would be put all over the place, but the reality is pools cost a lot to have them in place, and so usually governments end up subsidizing those for the most part, not always. Having swimming lessons. There's a strong public safety benefit for that. And so teaching our kids how to swim and how to be safe has both that community and individual benefit. So they're typically at the middle. Having a swim team. That's more of an individual benefit. Again, it's a smaller group, but sometimes, especially small towns, get great benefit from having a swim team. It keeps all their kids really active. It increases their name in terms of the statewide. They get to compete. It gives the kids something to do. So a lot of the communities will subsidize that, but it's still primarily an individual benefit with a smaller group. In most communities, if we walked in and said, I want to start an elite diving team tomorrow, and I want to put in a diving well, and I want our city council to pay for that by 100%, we'd be laughed right out of the room. Most people would say, no way. That's a very, very small group. It's considered kind of an elite activity. And so usually those types of things have special fees associated with that. So anytime we get into an elite activity, we're usually starting to think about a high individual benefit and a lower community benefit. So this is just one example relative to water or pools or aquatics. You can use the same type of thing with any category of service that's offered in an agency. Quite often we'll do the same thing with talking about parks at bottom level. Usually a non-monitored park is at level 1. Having something like a concession at a marina might be at the very top. So if you're going to take, having the lake there is at level 1. Having where I can go buy soda pop and hamburgers when I get off my boat is usually a level 5. So you break it into all different types of categories of service. There are secondary filters, and sometimes they get a little bit confusing, but I do want to mention them because people always say, well, what about having access to a service? Being able to get there is sometimes an important factor, and so we keep that in mind. Is it our organizational responsibility to provide? For example, things to meet ADA requirements. We have a federal law that requires that we are accessible to people with disabilities. And so it's important for us to make sure, usually those things are not covered by cost recovery. We don't charge more just because it's a small group of individuals that need those services. We do that as our responsibility from the organization. Historical expectations. I always like to frame this as, has it always been done that way? If our community loves tennis and we've had a long line of mayors who love tennis, guess what? We're going to have lots of tennis and it's going to be important. So we do have to take that into account because we are in a political world. The anticipated impacts piece often is related to marketing value. Are we going to perceive, if we have a big special event and we get everybody out there and we're doing that, but we're exposing everybody to everything else that we do and getting them active, it may have a different impact. It still costs us money, but we're going to do it because it's got a community-wide impact for some other reason, and that's a good justification to do it. A social value. Are we creating community? Are we getting people out? Are we helping in our health and all of those other social values that we have? So secondary filters come after the basic community and individual benefit.